Hi everyone! Welcome back to our channel where we discuss all things parenting and baby care. Today, we're diving into a topic that many new parents find both fascinating and concerning: weird baby behaviors. Babies can sometimes exhibit behaviors that seem odd or even alarming, but often these behaviors are completely normal. In this video, we'll cover 6 weird baby behaviors that can scare new parents, explain why they happen, and discuss when you should be concerned. Let's get started. The first behavior on our list is head banging. It can be quite unsettling to see your baby repeatedly banging their head against the crib, wall, or even the floor. But why do they do this?
Headbanging is surprisingly common among babies and toddlers, especially around the age of 18 months. It can be a way for them to self-soothe, express frustration, or even help them fall asleep. The rhythmic motion can be comforting, similar to rocking or sucking a thumb.
While head banging is often a phase that children outgrow, it's important to ensure they're safe. Make sure the crib is padded and free from hard surfaces. Observe the frequency and intensity of the behavior. So, when should you be concerned? If your baby is hurting themselves, if the head banging is severe or frequent, or if it's accompanied by other concerning behaviors like developmental delays or loss of skills, it's important to consult your pediatrician. Next up, we have breath-holding spells. This can be one of the most frightening experiences for a new parent. Imagine your baby holding their breath until they turn blue or even pass out.
Breath-holding spells are typically a response to pain, frustration, or fear. They can happen in 2 forms: cyanotic, where the baby turns blue due to a lack of oxygen, and pallid, where they turn pale due to a drop in heart rate. While these spells are usually harmless and the baby will start breathing again on their own, they can be extremely alarming.
If your baby has a breath-holding spell, stay calm. Lay them on their side and make sure their airway is clear. Most spells resolve on their own within a minute. You should seek medical advice if the spells are frequent, prolonged, or if they occur without an obvious trigger. It's also important to rule out any underlying conditions, such as iron deficiency anemia, which can sometimes be linked to breath-holding spells. Our third weird baby behavior is shuddering attacks. These can look like brief, intense shivers or tremors, and they often happen for no apparent reason.
Shuddering attacks are usually benign and often occur in clusters. They can be triggered by excitement, feeding, or changes in temperature. Unlike seizures, shuddering attacks don't cause loss of consciousness or postictal confusion.
These attacks typically last just a few seconds and don't seem to bother the baby. However, they can be quite startling to witness. When should you be concerned? If you're unsure whether your baby is having a shuddering attack or a seizure, it's crucial to consult a pediatrician. Seizures are typically more severe and may include loss of consciousness, rhythmic jerking, or unusual movements of the eyes. If your baby shows any of these signs, seek medical attention immediately. The fourth behavior is one that many parents are hesitant to talk about: infantile masturbation. It can be quite distressing to see your baby touching their genital area, but it's actually a normal part of development.
Infantile masturbation is a common behavior and is usually noticed in toddlers. It's not sexual in the adult sense, but rather a form of self-soothing or exploring their bodies. Babies often discover that touching certain parts of their body feels good.
It's important to approach this behavior without alarm. Distract your baby with toys or activities if you notice them doing this in public or excessively. When to be concerned? If the behavior is obsessive, causing physical harm, or if it's accompanied by signs of distress or other behavioral issues, it's best to talk to your pediatrician. Additionally, any concerns about inappropriate behavior by others should be addressed immediately. Our fifth behavior is rolling eyes back. It can be quite startling to see your baby's eyes roll back into their head, especially if it happens frequently.
Rolling eyes can be part of normal baby movements, especially during sleep or when they're drowsy. Babies have immature nervous systems, and their eye muscles can move involuntarily. However, if this happens frequently or is associated with other symptoms, it may warrant further investigation.
If your baby rolls their eyes back while falling asleep or during feedings, it's usually nothing to worry about, but keep an eye on the frequency and context of this behavior. When should you be concerned? If the eye rolling is accompanied by other symptoms like jerking movements, changes in behavior, or developmental delays, it's important to consult your pediatrician. These could be signs of a neurological issue that needs further evaluation. The final behavior on our list is unusual breathing patterns. Babies often have irregular breathing, which can be quite alarming for new parents.
Newborns and young infants often have irregular breathing patterns, such as periodic breathing, where they pause for a few seconds and then breathe rapidly. This is typically a normal part of their respiratory development.
Monitor your baby's breathing patterns, especially during sleep. Periodic breathing is usually normal, but there are certain signs to watch for. When to be concerned? If your baby has persistent pauses in breathing lasting longer than 10 seconds, shows signs of respiratory distress like flaring nostrils, grunting, or blue lips, seek medical attention immediately. These could indicate a more serious issue like apnea or respiratory infection. There you have it, 6 weird baby behaviors that can scare new parents but are often completely normal. Remember, every baby is unique and what's normal for one may not be for another. Always trust your instincts and don't hesitate to reach out to your pediatrician if you have any concerns. Thanks for watching and be sure to like, subscribe, and hit the bell icon for more helpful parenting tips and insights. See you next time.